a lot of magazines, what do they depict? Women who are like size 0, size 1, size 2, right? In swimsuits. And the rest of the women don't. It almost looks like the rest of the women don't count. And then when they want to talk about certain things like people who are lazy, people who are physically inactive, what pictures do they show? People with obesity. Without even getting to know why this person is in that condition. And I want to throw it out there. People with obesity is not a character flaw. It's a chronic medical condition, just like high blood pressure, just like diabetes.
Starting. Hello, everyone. Welcome again to another webinar by Love Your Menses and Your Health, a conversation with sister docs. Today, we're going to be touching on a very important topic. The title of this topic is Staying Healthy During the Holiday. It's going to be a discussion on healthy eating, exercise, sleep, and mental health. I am your host, Dr. Ebere Azuma. Please join me in welcoming my panelist, Dr. Yvonne Kengong. I know I asked you to welcome Dr. Yvonne Kengong, but I would introduce her formally. She's a board-certified family and obesity medicine physician. She's a clinical lecturer with the University of Calgary Medical School. This is in Canada. She's the CEO of Breakers Health, a medical weight management consultancy and public speaking company. She's the co-owner of KFS Script Meals. Basically, it's a company that focuses on diabetic, watch, and weight loss friendly meals and spices. She's the co-author of a best-selling anthology, The Warrior Women Project, which is a sisterhood of immigrant women. She's also the author of What's Obesity Got to Do with It? In 2019, she received a teaching award and another award from Alberta Legislative Assembly for community service. So it's an honor to have Dr. Yvonne Kengong with us. Hi, Dr. Yvonne. Welcome, 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 welcome. It's a pleasure. Again, we're going to be using her book that she wrote, What's Obesity Got to Do with It? For this conversation. Like you see, she's an expert in her field. She's a leader. She doesn't even talk about her medical directorship, which she holds. It's always a pleasure to have excellent, smart women with me to talk about your health. Again, we do this because we love you all and we want all of us to be healthy so that we can flow through life. How? Unapologetically. So welcome.
Yes. Thank you, Dr. Azuma. It's my pleasure to be here today. I'm so excited because you're my sister warrior. We wrote the book together. Thank you so much.
Yes. So, sis, before we get started, I just love you, right? I love you so much. I mean, you guys, like she said, she's my friend. We meet at least monthly to do prayers together. We chat on WhatsApp and we do a lot together. So she's my sister, but I want to share this amazing sister to you all. So you guys, please enjoy this conversation. Dr. Kengong, I call her Yvonne sometimes. So if you see me interchange it, it's not because I'm disrespectful. It's just, that's how we roll. Okay. So Yvonne.
Good.
Thank you. Yvonne, what motivated you to write this amazing book? What's the motivation?
So the motivation around this book was, in my practice, I was sick and tired of hearing about people who, let's say they get referred to an orthopedic surgeon, they get there and they tell them, you know, you need to lose certain amount of weight before you can come back to see me, without giving them the tools. So you just say, go lose some weight. When you've reached this amount of weight, come back to see me, then we can do the surgery. And then in my mind, I was like, if you're sending somebody to do something, won't you give them the tools? You know, then I also looked around me. I also saw that at some point I was gaining weight, you know, all the stresses of life, residency, staying up at night, you know, doing calls. You eat at 2 a.m., you eat at different times. I gained some weight and I started feeling like some joint aches and pains. And I said to myself, no, I have to do something about myself. While I'm helping myself, I'm going to also learn the tools to help my patients. And so that's when I decided to take the American Board of Obesity Medicine, because I wanted to learn more about these chronic medical conditions where people always often think it's a character flaws. And I want to throw it out there. People with obesity is not a character flaws. It's a chronic medical condition, just like high blood pressure, just like diabetes. And obesity is, people with obesity has a higher risk for diabetes and obesity and other chronic conditions. So if we are treating diabetes, if we are treating obesity, and those people with diabetes and obesity, they're not stigmatized, we should do the same for people with obesity.
Wow, I can't even proceed. I love how you said obesity is not a character flaw, and thank you for creating this amazing tool to help people with their weight loss journey. Well, why do you think people think obesity is a character flaw? What does that mean?
Because the media has made it look like eat less, move more, and you're good. That's what it is. And every time there's an advertisement about most things, like if you go to waiting rooms, a lot of magazines, what do they depict? Women who are like size 0, size 1, size 2, right? In swimsuits. And the rest of the women don't, it almost looks like the rest of the women don't count. And then when they want to talk about certain things like people who are lazy, people who are physically inactive, what pictures do they show? People with obesity. Without even getting to know why this person is in that condition. This person might have chronic pain syndrome. This person might have like mental health diagnosis for which they're taking medications, which can lead to weight gain, sorry. So it's really multifactorial, and there's so many things that come into play here. So before you look at the next person with somebody with obesity next time and look at them and say, you're just going to eat less and move more, think twice.
Wow. Think twice when we judge people that have obesity. Before you give us the definition of obesity, you touched something that is very important. You gave an example, a case study of an orthopedic surgeon telling a patient, hypothetical patient, to go lose weight without giving them the tools. Okay. Not all orthopedic surgeons do that. Please, we're not bashing anyone. Again,
Not at all.
Physicians. So we're not against physicians or bashing physicians. But there are some physicians that don't want to talk about obesity because they don't want to be associated with obesity shaming. So I feel like it's a fine line sometimes to want to talk about obesity and yet not shame the person. How can you help us so that we can be better as physicians when we are counseling people on obesity, especially since you're an obesity certified physician?
Yeah, I think the first thing is to ask permission from the patient to discuss their weight. When people are walking around there with obesity, they know that they have obesity. Most of them have tried so many different things. So if they come to your clinic and for something unrelated and you just go, let's say they have knee pain and you as a physician go, lose some weight, your knee pain will get better. It's a little offensive. You might say, okay, well, I know you're here for your knee pain, but is it okay if we talk about your weight? Is this the right time? Or do you think you'd want to book another appointment for us to talk about your weight?
Wow. Thank you. Thank you for the coaching. I know you're a coach as well. So thank you for that, asking permission before we discuss it with patients. So before we go any further, let's define what obesity is. Because I've heard some people, we're African Americans, we're Black, that said the definition of obesity is unfair, right, to Black women. So define what obesity is and talk about if it's fair or unfair. Thank you.
So I think the general definition, usually where people would look at it, it's like BMI, which is the body mass index. And they think of it like if it's 30 and above, then it's obesity. But we African Americans, we have, our physique is different. Heavy bones, increased muscle mass. So if you look at it that way, a lot of us would have obesity, would fall in that category. But the way the Obesity Medical Association defines it is a chronic, relapsing, multifactorial neurobiological disease where an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass, physical forces, which result in adverse metabolic, biomechanical, and psychosocial health consequences. So
Wow.
it's not, yeah, so you think of it metabolic, so you're thinking about things like diabetes or pre-diabetes.
Mhm.
Sometimes it can be polycystic ovarian syndrome, biomechanical, might be with the joints like arthritis and all of that, and psychosocial health consequences. So people with obesity, sometimes they walk around with the shame because of what society thinks they are, because everybody is giving them the blame game of, if only you could drop that burger, if only you could exercise more, you won't be this size.
Okay. I agree with you that there's shaming in it, but how can we be honest that people need to intentionally eat? You talk in your book about mindful eating because I mean, yes, if you have the data, great. There's just some percentage of people that have obesity because of chronic illnesses that you've listed out, endocrinopathy or whatnot. But there's a large proportion that's due to overeating. Like at certain point, I mean, we need to talk about it. For example, I
Mhm.
overeat too. I would be smaller if I controlled what I eat. Like, I grew up in a home whereby you had to finish your food. Even when I have guests over, relatives over, they get upset if we don't finish our food. And I'm like, don't worry, God will forgive me. It's my house, right? Don't worry about it. It's not your sin, it's mine. That we're discarding leftovers, but they get upset. So how can you be honest that overeating really is the primary cause of obesity and not just those chronic conditions?
So overeating is just one part of it. So there's a study that showed that healthy lifestyle, which is eating healthy and exercise, accounts for only 3 to 5% of weight loss. Because don't forget, I didn't mention it's neurobiological, right? So we have different chemicals in play, some that are produced from the gut, right? We have like the GLP-1, one of the chemicals produced from the gut, and that's is normally produced from the gut in humans, but now we have it in the form of Ozempic that is being prescribed, right? And then we also have leptin. So leptin is the hormone that makes you to stop eating. And then we have ghrelin. I call it G for gluttony hormone, and that's the hormone that makes you want to eat more, along with so many other hormones. And they send signals to the brain to say stop eating or continue eating. But for people with obesity, those hormones are dysregulated. And as a result, those signals are not fired the normal way like anyone else. So yes, a little bit of healthy lifestyle, meaning don't eat too much, reduce your portion size, would contribute. But then we also have to look at the neurobiology of obesity.
Okay. Thank you. So can you summarize quickly? I know you said it, but we have different people watching from the audience. Can you summarize the neurobiology of food or eating for us so that someone in the fifth grade can understand it? Because I do believe that if we can teach healthier lifestyle to our kids in middle
Mhm.
school, we can decrease the amount of adult obesity. So why don't you explain this concept to a fifth grader?
Yeah, so explaining it to a fifth grader is you see food in front of you.
Mhm.
There's that part of the brain, which is the wanting part that says, eat, eat, eat. You smell nice, you taste good, right? And then there's the other part that says, oh no, don't eat. You've had enough. And there's a hormone that gets secreted to say, you've had enough, which is leptin, that says, stop eating. And then there's the other one that is called ghrelin that says, eat, 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 right?
Mm-hmm.
So normally it's like an on and off switch. Normally, when you're full, the hormone shuts down to say, okay, now you're full, don't
Yes.
eat,
Mm-hmm.
which is the ghrelin will say, okay, you can't eat anymore. Then the leptin tells you don't eat. Ghrelin says, eat, eat, eat. But for people with obesity, that doesn't work. The switch, the on and off switch, doesn't work the same way. So because of that, what happens is even if they are full, they will still go for more food. And so now the medications that have been done, they work in that part of the brain to say, okay, now it's time to shut you up. Now that your brain can't really work that well, like that area of the brain that fires that, if now that it's not working well to say, stop eating, let me help you increase that amount so that you can stop eating. So that's the way it is.
Wow. That is awesome. Have they done a study to see if there's a ethnic or cultural differences in the amount of ghrelin or leptin secreted? Or
Not
my
that,
question, yeah, go ahead. My question in
yeah.
essence is, does environment affect the amount, the on and off switch of ghrelin and leptin?
So environment, it doesn't really affect it per se, but somehow it contributes to it. Think of it if you find yourself in a party, right?
Yes.
There's so much food and it's palatable, right?
Yes.
So the wanting center of the brain would want you to try that. So how do you prevent that from happening? It's not exposing yourself to the stimuli, which is even if you're in that avoiding that environment. It's almost like people who smoke. When we're talking about smoking cessation, what do we tell them? Don't go to the areas, don't go to lunchtime, don't go to the areas where people smoke or people who drink. Don't go to the bar, right? But then that's where it's very hard. People have to live their lives. So you can't always tell them to restrain everything. And that's where cognitive behavioral therapy comes into place, which is what we think is the way we act, right? Our feelings would let us act. And that's when the cognitive behavioral therapy comes to help that thought process shift to say, okay, I see you see this food, you like this food, yes, it's palatable, but what if we try to move away from it?
Wow. Thank you. Thank you. And I thank you for also clarifying that it could be unrealistic to avoid those environments of
Oh,
palatable
yes.
food, especially this time of
Oh, yeah.
holiday seasons when we have so much food, which is good, right? Because we have to
Mm.
celebrate coming together with family members. So, touch on some tools to help us control ourselves during festivity to avoid gaining weight during this holiday. Thank you.
Mhm. One tool that I always would say is somehow, if you can eat a little bit before leaving for those occasions, because a hungry mind is very difficult to make those healthy decisions, right? So if you go into an event, if you eat a little bit of some healthy food, right? I'm not saying that there are some foods that ultra processed foods. We don't want people to indulge on that. If you
Yes.
can load up on your fibers, on your proteins, then when you go out to those events, you're not that hungry. So then you can make better choices. Another thing too is sleep. So if you sleep at least 7 to 9 hours a day, the executive lobe of the brain, which is where you have the decision making lobe, you're going to be able to make the right decision. But if you're exhausted, think of it when you're on call, Dr. Zuma, right?
Yeah.
You're passing around in the food cafeteria. What do you go for? It's always
Yeah.
those palatable food. You
Yes.
want the wanting, the hedonic system or the wanting system is like, pick me, get me, get me. What are you going to grab? Maybe a chocolate bar, maybe something else, right? Because you're tired. You can't really make those good decisions. So sleeping at least 7 to 9 hours would also help with that.
Wow. Wow. That is so awesome. Thank you for tying in sleep and sleep and weight loss or weight gain. Can you touch more on sleep? Because yes, it does help us think better, right? It unloads our executive load, as you have clearly defined it. But is there more to physiology of why sleep helps with maintaining good health? Does sleep decrease cortisol? I don't know if you have any
Mhm.
thoughts on that.
Yeah, so with stress, let's say you haven't slept well, your body is almost like in a state of stress. What happens? Cortisol goes up. If cortisol goes up, all the other inflammatory markers are secreted, and that's why it can lead to like diabetes and all those, because all the cytokines and interleukin 6, all those things are secreted also. But when the body is well rested, inflammatory markers decrease, and also when you're well rested, the hormones function, the leptin and the ghrelin, they also function um, better, right? But it's so complicated. It's something that can take a whole months of lecture, but that's a simple course version of it.
Awesome. Okay, thank you. Okay, so just if I'm talking to a fifth grader, because Love Your Menses, we cater to younger people,
Hmm.
people new in menarche and whatnot. So if I'm talking to a fifth grader about the importance of sleep, which they should be sleeping well, right? Obviously,
Hmm.
we're talking more of adults not sleeping well. So we say sleep is important because one, it allows them to make better healthy food decision, and two, it also decreases stressors and
Yes.
inflammatory markers that can
Hmm.
make them overeat or to lead to chronic diseases. So thank you for that. The
Hmm.
next question is, you talked about Ozempic and those medications that help with weight loss. Can you talk more a little bit about it, and should all of us be on it? Because can it be prophylactic? You said obesity is a chronic condition, and we love to decrease chronic diseases. So why can't all of us be on Ozempic? Again, I'm not promoting it. I'm just trying to learn.
Well, not everyone has to be on Ozempic or should be on Ozempic, right? There's always a criteria for everything else, like all the medications we use, right? So it's usually recommended for people with a BMI of 27, right,
Mhm.
with at least one or two medical comorbidities, which can be high blood pressure or hypertension, or a BMI of 30, right? And there's also contraindication. People who have papillary thyroid cancer, people who have, there's another multiple endocrine neoplasia, which is a constellation of other syndrome type 2, they can't really
Mhm.
take it. People who are pregnant, they can't take it. Those are just some of the contraindications. If you fall into that category, then yes, we think of it, right? As we know, Ozempic is being used off label because it's actually a medication that was initially done for diabetes. But then they found out that people who took it, they lost significant amount of weight. And then right now it's almost a big thing, right? Which is a game changer in the world of obesity medicine also. Yeah.
Yeah. So how does Ozempic work?
Yeah, so Ozempic it's released from the gut, right? So the normal one is a GLP-1, which is a glucagon-like peptide 1 hormone that's released from the fat cells of the gut. What it does is it sends signals to the brain. I'm just trying to explain it in the fifth grader way. It sends signals to the brain, and it gives you that sense of being full, and it also decreases cravings. And as a result of that, you lose weight because suddenly you look at the food and now, oh, you don't have that much craving. And then even when you find the food you eat, you don't eat that much. So ultimately leads to weight loss. Most common side effects, since it works in the GI, which is the gastrointestinal tract, people get nausea, people get vomiting, some get constipation, and yeah, those are like the most common side effects that we see with it.
Thank you. Thank you for explaining this. I think most primary care physicians should consider becoming an obesity medicines expert, because as an OBGYN, when I talk to patient about weight loss and I say, have your primary care physician evaluated you if you're a candidate for Ozempic? They're like, what is Ozempic? And some of them even have diabetes. So, I mean, what is your take? Do you think more primary care physicians should know more about obesity so that they can help decrease the prevalence of obesity in our community.
Yeah, I agree, right? It's, it's a chronic medical condition. It leads to all this diabetes, high blood pressure, name it. Sleep apnea, which is a condition where you stop breathing at night, and because of that, a whole shebangs of different things can happen as a result of that. So if we treat that obesity, what happens? We're going to prevent that. And because we're preventing all those other medical conditions, there's decreased absenteeism from work. So it's a win-win for the employer, it's a win-win for the employee. And if they don't have those chronic conditions, they have more time, they enjoy life, decrease morbidity and mortality, right? They're able to enjoy life with their family, they're able to live a longer life, right? So if we stop it before it progresses to all those other medical conditions, it's a win-win for everyone.
Wow, I love that. All right, let's talk a little bit about obesity in children. We do know that in our community, I'm talking about the Western world, specifically the United States and Canada, where we both reside in. You reside in Canada, I reside in the United States, just for clarification. We see that although people have obesity, high caloric intake, we still see that we have micronutrient deficiency. And some micronutrient deficiency affects just the functioning of people. For example, some people are tired because they don't have vitamin D. Just because people have obesity doesn't mean they're healthy. Can you touch more on that? And while you're touching on that, can you talk about obesity in children? Because I worry, I was skinny as a kid and I'm bigger now. If I was bigger as a kid, I'll be way bigger now. So what would you say to parents listening? What is their role, or what can they do to help prevent a higher prevalence of obesity? Thank you.
Okay, so this question, thank you for the question, Dr. Azuma. This question is multifaceted, meaning there are too many people in play here. First, it starts from the policy makers. Right. So what do I mean by that? In schools, for example, as time goes on, we notice that physical activity decreases every year or every few years. So now we have a generation of more sedentary children compared to growing up. An example was me growing up back in Cameroon. There was so much to do. You could go out and play. And same, even to some Canadians here, they will tell me too that, you know what, when we were growing up, we had so much time for physical activities. But as time goes on, you see suddenly it's like 120 minutes per day. It becomes 90, it becomes 60. And when they get into the high school level, it almost looks like other things come to take into place, like as a priority. So that's one thing. What about the drinks and the food that we see in some of those schools? What would happen if we have vending machines for healthy food, vegetables, and all of that? Why does it always have to be Coke? I'm not just calling the Coke, I'm just thinking pop, let's say soda. Why does it always have to be soda in those schools? What about the cereals that our children eat? Have you ever looked at the box? A lot. Sometimes it's like 26 grams in a little bowl. Some of them have colorings in it. So there's just so much that we all as a community, we all as an organization have to work together. And then there's the food pushers who say, you go to an event, you're eating, and they look at your plate. Oh, is that all you're eating? Come on, eat. Are you on a diet? And then it's almost like they're making fun of you. Are you on a diet? Eat, right? And then maybe one auntie might come, with all due respect, aunties, we respect you. Is that it? What is this? You don't like my food? Please eat. Let me do like the Nigerian auntie. Please eat, Joe. I suffered to cook this food, I suffered to cook this food. Please eat. Oh, what are you going to do? You don't want Auntie May or Auntie Joanne to be upset with you. You're going to eat. So those are just some of the things. And then now you're full. But then you auntie is giving you this look, or mommy is giving you this look of, I suffered to cook this food. Don't you dare throw the food. It's almost like we came from that culture of scarcity where it's like, don't throw food. When you're full, your God can handle more, right? So we all have a role to play.
Wow. I think you still have more to say. We're
I,
talking.
I can I
Yeah,
can go on to tomorrow. I can go on to tomorrow.
yeah,
Okay.
please
Then
do.
now,
So we've talked about
now,
the policy. We've talked about peer pressure. Okay, go ahead.
yeah,
Talk.
we talk about the family dynamics, right? When
Mhm.
there's a celebration, what happens? It's always food. Opa, lots of food, right? Food and drinks, let's dance, right?
Yeah, yeah.
So, so those are just some of the things. We are in an obesogenic environment. That's just the way it is. There's always food within reach. Years ago, the cavemen, they had to walk far to get their food. But for us, everything is at our disposal. I just have to walk to even to the corner's gas station to fill up my gas tank. When I get into the office behind, there's food there waiting for me, right? So, yeah. And then now, I'm going to give an example of the African context. Now you get pregnant. All the aunties say, eat, eat, you're eating for two, you're eating for two, you're eating for two. For me, when I was in Montreal, right, I was seeing a dietitian there. They said, oh, you have to eat for baby. I was drinking a liter of milk, 3.25 every day. Breastfeeding, oh yeah, after that you have to
Yeah,
you're breastfeeding, right?
yeah,
So drink the
yeah,
milk. So those are just
yeah.
some of the things you're eating for two. Even when
Yes.
you're full, you're like, I need to add a little bit more. I'm eating for two. Then some people get married. You want the family to see that you're taking good care of the husband or the wife. Yaomi, eat now. Oga, you come with this big food, but Oga, eat now. And then Oga starts getting a little pot belly. Oh, and then in Cameroon or Nigeria, money man, feeling cool. You know what I mean? So there's too many layers. It's like an onion ring with too many layers that we have to peel one by one before we can all fight this obesity.
Awesome. Thank you so much for going through all of the levels. I appreciate that. But I still want you to touch more on recommendations for parents with an obese child. What can they do to prevent adult obesity if their child is already obese?
Okay.
Mhm.
Yeah. So point of correction, I'm just gonna
Yeah.
change the word. So in obesity
Okay.
medicine, we define the person by their medical condition. So I would say a child
Okay.
with obesity because the
Okay.
obesity doesn't define the child, or
Thank
a
you.
person with obesity, or a female with diabetes, or
Okay.
a
I
male,
like
a
that.
female with high blood pressure, right? Yeah.
Yes, I like
So
that.
for a
Thank you.
child with obesity,
Uh-huh.
it, so to prevent it at the home level, we have to think of increased physical activity,
Okay.
following their portion sizes,
Okay.
sleep.
Okay.
We, the parents, we do all the shopping, right? Making
Mm-hmm.
sure that we don't fill the house with all those sugary, ultra processed food.
Okay.
But then it also, going back to the neurobiology of it, we
Mm.
also have to they also have to be referred. If you're a primary care physician, you can refer them to a multidisciplinary team so that we can have that approach. We
Okay.
could talk about the psychological, we should talk about the mechanical, the mental, and the metabolic complications of obesity.
Okay.
So we have to look at all that. But we can do our best from home by training them, decreasing screen time because we are becoming a bunch of sedentary people. Phone,
Okay.
phone, 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 video games, right?
Okay. 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 Wow. So that's interesting. Okay. So you say increased physical activity. We're both immigrants to the Western world, and most immigrants have a lot of jobs,
I know,
because they are taking care of
I
their
know,
parents back home and they're working here. Most
I know.
most of immigrant families, they don't have time to increase physical activity. So
That
what are
is the
some
hard
so
part.
yeah. So what is, or time to cook healthy, to them, including myself, not judging anyone, it's just a checklist, right? They ate. It could be an ultra, like you call it, processed food, but they ate, right? They've eaten, they're not hungry. So can you
Mhm.
go through like a model, for example, physical activity? Must it be going outside? What are some tips, if you have them, on how to
Mhm.
increase physical activity in the house without
Mhm.
having gym equipments, right? So what are some
Oh yeah,
suggestions? Yeah.
dance. As simple as dancing. Kids like dancing. We immigrants, we like dancing. It can be just part of a family bonding time. You just put music and you dance, right? If you can do that, the recommendation is, let's say, 150 minutes a week, right? And then it goes higher for people with obesity. So just for overall health benefits, at least 150 minutes a week, right? Just encourage the kids to do that. Right now, with all the technological gadgets, they have all these dance parties or on Xbox and all of that, if they have that. If not, even the radio, just create a time where they can just put that and dance. It's easier said than done, right? But the kids model after us, the parents. If we try, I know it's hard, right? Some days I find it hard to carve out that time in my schedule to do any physical activities. But the way I look at it is, I come first. If I fill my cup every day, then I can pour out of it and enrich and help others and support them better. But if I wake up in the morning and I'm running around, I have to come to the clinic, I have to see everybody else and all of that. At the end of the day, I'm going to be exhausted. And then when I sit in my mind to say, at the end of the day, to say, what did I do for me today? I'm not happy about that.
Wow.
Because I try to take that daily scores at the end of the day. Okay, I've gone out there, I've seen this number of patients, I've done this, and then I go, but wait, Yvonne, what about you? What did you do for you today? So I think that's one question that we all have to ask ourselves every day, because there's only one you, right? I tell my patients I can be here every day taking care of you, but there's only one me for my family. So if I get to a point that I need that break, I'm going to carve out that time to take care of me because there's only one me. So just creating that time to do something for you. It doesn't have to be 30 minutes. It doesn't have to be an hour every day. I say little drops of water fills an ocean. Little behavioral changes becomes a habit. Consistency is key. You can start today 5 minutes, tomorrow and 10 minutes, maybe another few day 3 4 days, another 15 minutes or 12 minutes. But with time it becomes a pattern, and then we all know when you exercise it releases all the endorphins, it feel good, and then now you're able to give. You know you're a happier person, your mental health is improved. So it's not exercise is not only about losing weight, it's also about your mental health.
Wow, that's a good way to end, but we're not going to end yet. Okay, so you're telling, I'm talking to that immigrant family that wants to incorporate dance, but it's kind of hard, especially if you have like a teenage child or a preteen and say, "Oh my goodness, we're going to start dancing." It's uncomfortable. So, do you have a tip on how the parents can bring it up to their kids? Some of us, we've talked about this before in our previous show, and we're going to be talking more about it in our next show, where there's some conflict sometimes raising a kid in the Western world as an immigrant parent, the miscommunication and whatnot. So you have this preteen that's obese, and now you want to incorporate dance, as Dr. Yvonne has suggested. What are some tips to like do that?
You gotta try. You gotta try. Somehow you might say, you know what? Please, can we just make this a bonding time? I just want to get to know you more. You know, a family that plays together, prays together, stays together. Think of it. So I call it the two P's: pray together, play together. And let's add it, party together at home, right? These
Yes.
days, because during those times, there's so much that you exchange. Even you're playing games, you learn so much about even your kids, right? What they like and what they don't like. Maybe some of their mannerism if they're losing the game, right? So just those are some of the things. But as I mentioned earlier, also, it's really hard at the home level, and that's where those physical activity curriculum in the school area has to continue.
Wow.
Because
Wow.
when you are struggling to pay your bills, you love your children so much,
Hmm.
but you gotta pay the bills. So it's hard. I get it, it's hard. So that's when the schools come in, the policymakers come in to say, let's keep this, let's keep these physical activities. Instead of decreasing the number of hours a week, let's see if we can increase it.
Wow.
It's a
Wow.
win win for everyone. Because
Wow.
when we have that chronic medical condition, it's taxpayers' money that goes up with the health spending accounts.
Wow. Wow. Thank you
Increased
so
complications, right? Yeah.
Yes. Oh, thank you so much, Dr. Yvonne, for this wonderful conversation. It's so beautifully done. Thank you for the tip. Some take home point is increase physical activity, eat healthy, don't shame anyone for being obese, and because it's a chronic condition, take permission before you discuss people's weight, have fun, play together, pray together, party together, and stay together as a family. And lastly, taking care of yourself is self-love. So I appreciate you, Dr. Yvonne. Dr. Yvonne, please come back in 2024 so that we can focus on childhood obesity prevention and maybe talk about ways that policymakers can help fight obesity. As you've suggested, and as the data has shown, obesity is expensive. It leads to chronic problems. It also leads to cancer. It also leads to
Yes.
a poorer mental health. Thank you, Dr. Yvonne. Let's go now to our announcements. Anything else you want to add before we go to our announcements?
Thank you, Dr. Zuma. I'm really grateful to be here today. One thing I want to say before we
Mhm.
end is
Mhm.
remember, obesity is not a character flaws. Let's be kind to people with obesity. You don't know what they might be going through.